Up the dots. On the one hand, an economy that at least CEOs are concerned is not going in the right direction. The chief economist at the White House thinks otherwise, but CEOs have some doubts with the deficit.
Yeah, I think the deficit is an issue. I think people are rightly concerned with the levels of our deficits, considering the fact that the economy is actually doing well. I mean, the way this is supposed to work is deficits are supposed to be low when the economy is doing well, and when the economy is not doing well, deficits go up because the federal government provides typically stimulus and spending to the economy. So what we're seeing now is the reverse of what we should be seeing.
So it's intriguing to me that you are advocating getting our arms around the deficit, which I can't find too many people these days on either side of the aisle are advocating. And in fact, your own party, the Democratic Party, seems to be going the other way. We have people talking about MMT, modern monetary theory, saying, you know what, we shouldn't be worrying about the deficit at all, as long as we're borrowing in dollars and we control dollars. So where do you take issue with them? What do you think about MMT?
Well, I don't think MMT really, I don't think there's any basis to it at all. So that's not where we should be spending any time. I mean, listen, I don't think we've got to fix this right away, but what we do need is kind of a long-term trajectory that starts getting these deficits under control. Under my policies, I believe I can get deficits to about -2%, right, of the economy. And if the economy can grow at least 2.5% a year, which I think it can with the right policies, then the debt as a percentage of our economy is going to go down and we'll be fine. But I think that's the way we've got to think about it. And to do that, we have to fix health care because it's the main driver of kind of our spending issues over time. And I have a plan to do that, and I think I'm the only one who can get it done. And we have to relook at our tax policy and some of the tax changes that went through with this last GOP tax cut bill.
Okay, let's take those two in order. First of all, fix health care. Again, a number of the people who are now running against you, they're later comers, but they're running against you, say we need to really expand out. We have Medicare for all, for example. We have single payer, things like that. Is that the way to fix health care? How do you do it?
We need a universal health care system. Everyone should have health care as a right. We actually have that kind of a system now, if you think about it. Anyone can go into an emergency room and they're required by law to get treated. It's the dumbest kind of universal health care system you could possibly have. What I'm calling for is to leave Medicare alone, create a new program that everyone gets from when they're born to when they're 65. You roll Medicaid into that. But people can opt out of it, buy their own private insurance if they want. They can buy supplemental plans. So it's basically a government plan, right, a backbone government plan that everyone gets as a right, and then you have the private market kind of floating on top of it, and you pay for that whole system, fully paid for, by taking away the corporate deductibility of health care. Because if you ever want to get health care costs under control, you have to de-link it from people's jobs.
Wow, that's a very bold proposal. That's going to affect a lot of people in their pocketbook, isn't it? When they get their,
no, I mean,
they take home, when they have a deduction now for income that's attributable to health care?
No, I mean, this is the way it works right now. If you know, at your company, you get health care,
right,
you're not taxed on it, and the company gets an exemption.
Right.
Under my plan, you'd show up to work with a government plan. Now, the company may want to get you better options, so they may negotiate a group supplemental for you, right, which you buy into. Now, it won't cost you that much because your kind of major medical is covered by the government plan, but it's your decision to get the supplemental. So, no, I think you're in a better position, right? You're able to keep what you have, and you have this portable plan. So if you decide to go start a business or get another job or something, it follows you where you go.
But, John, why isn't that just moving deck chairs around, so to speak, in this sense? We're now, what, approaching 18% of GDP, something like that, for total health care in the country? Isn't the fundamental problem we just are paying too much, considering what we're getting out of it? We pay way more than any other developed country, as you know, per capita for health care, and our results are not as good as theirs. How are you going to bend that cost curve? Is your plan going to help do that?
Well, one of the ways you bend the cost curve is to get more people, insured, right? Because, again, right now, a lot of people run around and they get health care services from the system, but they're not part of any kind of health insurance or government program. You know, a lot of health care providers have huge bad debt, particularly hospitals. So you got to do that. You got to change behavior. You got to create incentives for people to engage in more preventative care. They have to have a sense as to what health care costs. I mean, right now, with your health care tied to your job, when healthcare costs go up, a lot of Americans don't get raises. And so many Americans kind of run around not having any sense as to what any of this stuff costs, right? Because their company is paying for it. So that's why I think we'd be better off if everyone had a healthcare plan as a right, and they could buy supplementals, or their company could arrange supplementals for them. I think it connects people more to the cost of health care. It creates more incentives for them to engage in preventative care, and it gives everyone health care as a right, which I believe is a basic human right. And again, my plan is fully paid for. All these other people calling for these proposals, they have no way of paying for it. And having the government be the only payer of health care is a terrible idea, because the problem with that is the government never pays enough, right? None of the government programs, Medicaid or Medicare, actually even pay the cost of health care.
So the other thing you mentioned was a reform, I think you said, of the tax system. Again, we have other Democratic candidates now for president who are really proposing some fairly substantial increases in taxes, particularly for the people up the income scale. What do you think of as reform?
So I think where we got to focus, because I do think high earners need to actually pay more, but I don't think the right way to do it is to keep kind of raising the marginal rate. That actually doesn't in many ways do much. What I think we need to look at is something like the Buffett rule, which effectively creates capital gains rates, makes them more similar to ordinary income rates, right? I don't think we can have a society where the investor class, people who just invest for a living, and I've got nothing against them, but they shouldn't be paying half the tax rate as working Americans, right? We created the capital gains incentive in this country at a very different time, when we needed to create an incentive for people to invest. As you know, because you cover this all day long, David, everyone's investing. Markets are super liquid. Things have changed. We don't need that preferential treatment. Maybe for certain things, right? If you hold an investment a really long time, because that encourages small business creation, or maybe to create incentives to invest in distressed communities like the bill I led in the Congress, the Opportunity Act. But in general, I think we've got to close the difference between the capital gains rate and the ordinary income rate. It's what's fair to everyday hardworking Americans, and it'll actually raise a lot of revenues. That's where I would focus. And the Buffett rule is a pretty simple way of doing it.
So John, you've got some innovative, I'll call them, proposals here. How do you get your voice heard? As I understand it, there's some sort of a rule, I guess, of 65,000 contributors, and you've got a plan because you're self-funding largely. You've made money as a successful business person, and you've got a plan where you'll actually match and even double contributions to charity. How are you doing? Right. How are you doing on that? How far
We're doing great. We're doing great. It's called the Delaney Debate Challenge. You go to johndelaney.com. You give me $1, and I will donate $2 in your name to one of like a dozen charities that we've got up on the website. So you give me $1, I give $2 in your name. It's a really good deal. It helps us get to our 65,000 donors as quickly as possible. If people care about having a problem-solving kind of centrist who has real ideas about how to move us forward on the debate stage, that's a way people can help me, and you'll be doing something good in your community too, because $2 will be given in your name to charity.
So, as I say, you're a successful businessman. You measure things. How far are you along to that 65,000?
Since we've started this, we've actually made a lot of progress. You know, we're making progress. We're going to get there, but I wanted to get it done as soon as possible, which is why I launched this. I also, you know, the way to actually get small dollar donors is to hire a lot of digital marketing firms to get them for you, which I'm fine with, but I'd actually rather give that money to charity to some extent. I always think of a philanthropic angle to solve every problem, because that's how I think we make a lot of progress in this country, is when the government and the private sector and the nonprofit sector work well together. And the Delaney Debate Challenge is kind of an example of that on a small scale. It's you know, I'm a problem solver. This is how I'm going to solve the problem of getting 65,000 small dollar donors.